at MOSA. MOSA has been renamed as the Ministry of the Human Development. We have launched last year the National Social Protection Strategy. We also, as you heard earlier in the day, have now the disability program as well as the pension scheme, right? But of course, with all of these progresses, we also are facing a lot of challenges, including multiple crises as well as multiple shocks. I also wanted to say that this research project was a bit of a spin-off from the basic research program that IDS at the University of Sussex has led. So I wanted to thank FCDO for actually funding that. And then we met CAMEALEON, and this study then became like a spin-off of that. I also want to say that this study was quite comprehensive. It's a big study, and it was led by a team of 9 people, including myself, the program manager who is currently not with us, Lena Farran. The fieldwork was led by Bassam Musa as well as Noor Shaiban. And we had Maria Dahir with us, as well as Joanna Dahir, Karim Khansa, and Claudia. Thank you for the team for making this a huge success. And then I also want to thank each and every one of you. You all also contributed to our key informant interviews. Many of you did, many of you have now left, but thank you so much for participating in the KIIs and that part of the study. So we are here today to talk about navigating social assistance in Lebanon, the experiences and insights of the bottom quarter. Okay, so without boring you much, I'm just going to talk a little bit about the literature and what the literature actually says. So of course, you know, our social assistance started in 1963, and then came multiple enactments of laws, new decrees from 1987 up until 2004. And now, as I mentioned, 2005, many new schemes have actually cut in. But basically what the literature says about social assistance is the fact that it's a fragmented social protection system, which means a lot of different organizations are involved in providing social assistance, whether it's from the state, whether it's from international organizations, local organizations, charity-based organizations, etc., etc. So there are multiple fragmented stakeholders that are involved. I just another mention, Corey, thank you so much for your study. I was very pleased to see a lot of parallels with his study as well, which actually makes us think as researchers that, yay, we got it, we're both on the same team. So there was a lot of opacity in targeting of social assistance. A lot of people also, the literature says that the criteria for selection is quite opaque. And people themselves are not sure how they were chosen, what is the criteria, etc., etc. There are multiple barriers to accessing aid, including, as Corey mentioned, the transportation, access points. All of these serve as informational barriers as well. People who are perhaps illiterate were not able to access social assistance. We also have the emotional and psychological impact of accessing aid, which means when people did not receive their proper updates, when they didn't know why they were selected, when they were put in that box of vagueness, this left an emotional toll on them. They would be anxious. They would be quite stressed about, are we getting money? Are we not getting money? Is this happening? Is this not happening? Are there any updates? Do we get it in crisis? Do we not get it in crisis? So there was a lot of like emotional toll on and an emotional impact. We also have aid inequity and spatial disparity, which means that, and this was why I mentioned the basic program. So in that program, we had a paper and a report that was specifically that aid is inequitably dispersed, which means people from different nationalities, if they were based in a different neighborhood, aid is not uniform. It is dispensed and dispersed in a different way, and it can differ according to nationality and region, which also Corey pointed out. We also have the role of networks in accessing aid. A lot of people believed also, and the literature said that people who have connections are more likely perhaps to access aid than people who don't have connections, whether it's through proxies, whether it's through the international organizations themselves, the locals, such as al-makhatir, municipalities. So all of these were seen as important to accessing aid. And then we have gender-based barriers to accessing. So although we have made a lot of progress in terms of gender, but still women in particular face a lot of barriers in accessing aid. So our research questions were 3. What are the perspectives and the experiences of the bottom poor Lebanese people on enrolling and being part of and or being excluded from social assistance programs, specifically the NTPT and the ESSM? What are their perspectives and experiences regarding the key design, such as targeting, regularity, transfer type, size, and mode of delivery, as well as implementation aspects, registration, claiming, receiving of these social assistance programs? Our third question was, what lessons can be drawn from the perspectives and experiences of the bottom poor for improving the inclusiveness and effectiveness of social assistance programs? So this was the premise by which we actually started from. Can we move to the next slide, please? Yeah, okay. But before I enter into the methodology, I just have an important point to say. So this report seeks to move beyond policy analysis of design and the normal. So what we are trying to do here is to provide the valuable insights of the bottom poor and their perceptions and experiences. And I think this is very important to note, because I think we all say that, oh, people stood in line. People faced a lot of difficulty in accessing ATM machines. Some people took their money from them. But this is the first time that this has been documented. So now you actually have all of these documented in one space, but based on their perceptions and experiences, okay? And this is the value added of this report. Concerning the methodology, so this is a mixed method study, which means it employed quantitative as well as qualitative tools. However, I just want to note the following. Concerning the quant was led by Dr. Ali Shala, my colleague at EUB. So I'm not a quant person, just as a disclaimer for everybody. But basically, we received the MSNA study from NRC. And what we did is we had these survey entries and we did a vulnerability scoring, which was calculated for 783 Lebanese households. Now, the entire MSNA data set stood at about 2,028 survey. And what we did is, so they reviewed the literature for how to come up with a vulnerability score based on either households with disabilities, households with diseases, that single female-headed households, and we came up with our own vulnerability score. And we said, okay, so from the MSNA data, this is the number of people who are the most vulnerable. And we came up with the first quantile, from 1 until 5, the fifth quantile of the poorest, most vulnerable people to actually reach out to and to include in our qualitative then study. Okay? Yeah. Can we move on to the next slide, please? Right. So to cement our findings, we, of course, went on to do a qualitative study, and the qualitative tools were as follows. We did in-depth interviews, 49 interviews all around Lebanon. I will explain the geographical basis in a second. We did 6 focus group discussions, and we did 11 key informant interviews. No, can we just go back, please? Yeah. So we took the MSNA data and it had specific geographical locations. And then what we did, we also wanted to expand on it a little bit more. Through our personal networks, we actually reached out to also the similar variables that were chosen from the MSNA data, i.e. people with disabilities, single women-headed households, what have the same variables. We reached out to new areas to expand on the MSNA data, including Beirut, that's Karantina, including Metin, Bikfaya, and Burj Hamad. Okay? So, and that was the rationale. The rationale was very similar to the MSNA to identify the bottom poor and to actually expand on it, expand on the MSNA data qualitatively. Okay, so in terms of participants, I'm not going to dwell a lot on this, but the information is all in the report if you want to go on and get the details that you wish about the methodology. So we had receiving, non-receiving. We had. Can we move on, JP? Okay, so these were actually the areas covered. It was سير الضنية, برج حمود, كارنتينا, صيدا, عين بعال, بيسارية, بكفية, إبليس, and حمرة. We were doing the study at the time of the war. Accordingly, our line to expand into the south, we actually stopped at Saida. Simply due to security reasons. At that point, it was absolutely impossible to include people from the south, which is why we actually decided to also include Beirut to get a more diverse representation, so to speak. But again, this is a qualitative study. We're not really talking about 100% representation. So status of participants in IDIs per region. Again, this is what we had. We had receiving, non-receiving, and then we had male, females, again, receiving, non-receiving. So we had like a quite a broad understanding of the qualitative people. We included the females, the receiving, non-receiving people, as well as people from different areas. Okay, so our findings by thematic. So we're going to try to really cover this in depth as much as possible. So our findings were that there is an effect of multiple crises on receiving social assistance. Disrupted social assistance was one, which means participants described that their assistance was sometimes interrupted. It was discontinued during the different crises, specifically, for example, during 2019 COVID, the August 4th explosion, and the Israeli war on Lebanon in 2024. So this deprived them from very financial support that they really, really needed at that time. And they really were quite disgruntled about this lack of communication.
Expand a little bit more on this thematic, especially for people in the South. We had so many people who used to receive aid during and before the wartime, and were discontinued from aid without any form of compensation later on. So many people dependent on this aid, especially when they had to relocate after the war and did not know where to go to. During the war, one of the social assistance offices in Sur was bombed, and so people there did not have any form of access or information as to the process of their application or the interrupted aid assistance.
In terms of social assistance and resilience, the successive shocks that were experienced by the Lebanese altered participants' economic realities and perceptions of social assistance as a main lifeline. So they used to view it as a main lifeline, and these shocks have changed their perception. So those who had received assistance would plan their expenditure based on the fact that they will receive it. So according to Noor, you want to cover the man and... Yeah.
So basically, most of the participants depended on this aid to cover basic costs like rent, electricity, heating, and school fees for their children. So it was particularly very difficult when aid was interrupted. At first, it was a form of dependence. Now it's a full codependence on the programs as a main lifeline for day-to-day conditions.
Right. So the crisis basically triggered an exponential increase in living costs, and it also resulted with a reduction of the available aid, exacerbating an already dire situation for low-income households. As a result, these households have developed complex coping mechanisms, such as borrowing money, such as, for example, deciding what to eat and not including protein for several meals. And we have one participant who said that a lot of things we didn't get anymore, such as meat, chicken, we would get some, but much less at this particular point in time.
It's important to mention that most participants also rely on this cash assistance for medical costs. This was the main bulk of the perceptions that we've collected, that the aid that they received usually went to cover medical costs, which means that they didn't have any more assistance for different dimensions of their day-to-day lives. So medical costs and chronic illnesses were among the main resources that needed to be covered.
Right. In terms of perceived ineffectiveness in social assistance during crisis, so there was a widespread view from most participants who believed that the state was incapable of providing for their needs. They thought that it wasn't providing reliable support nor consistency because during these emergencies and shock, people had relied so at some point, I think what they said is that they thought the state was unreliable and did not provide because also they were getting provision from the NGOs. And so they actually viewed this as like intertwined, that the state didn't provide, it relied on the international organizations, and they would want the state to actually take a lead on that. Does that make sense?
Most of the participants acknowledge that it is partially NGO work that have been covering most emergency relief mechanisms in the country, and so they resort to that because they suggested that it's much more systematic and straight to the point.
If I may add, actually, the perception was that the NGOs or NGOs are providing better than the state, but this somehow they do not believe the state has much responsibility. So their judgment and perception was always a function of this comparative observation. You see, and there are so many factors that we see its ramifications in other findings. Okay, thank you.
They did express that there was a lack of reliability in terms of how aid was distributed, especially in times of crisis, which was depicted in different regions. So different regions in the country had different problems that they were facing, depending on where they were. People in the south had different problems than people in the Matin, than people in the north. So NGOs.
So in terms of outreach, targeting, and design opacity, people thought that there was an ineffective outreach to communities in need, which means they really thought that a lot of areas, a lot of different neighborhoods were actually not covered. They perceived that there is a significant role for political networks and local authorities in accessing aid, and this is something I mentioned before. So people absolutely perceived that being part of a political party or being connected to someone at the municipality or knowing the Mukhtar or knowing anyone would actually help them in receiving aid. And this is quite important because they believe absolutely that it's not the proxy means testing. It's not like, it's if you know someone, you will get aid. صح. There was a widespread lack of clarity and trust in targeting and design. And this is something that they all mentioned, which is like, they know that there is a proxy means testing, but they have no idea what this proxy means testing is. So whenever someone would come for a home visit to ascertain if they are poor or not, they don't know which targets to actually mention. And that results also with a lack of clarity and trust because they don't know what this PMT is or on which basis they are being selected to actually receive aid. Next, please. In terms of barriers to accessing aid and support channels, we also, this is something Corey mentioned in his study, and I'm happy to see that. It's digital and functional illiteracy, which means that, yes, by having, we advertise this and everybody knows about this, but a lot of people also mentioned that, okay, hang on, there is a very large number of illiterate people, which actually hinders their accessibility to aid because they are not able to go to the link. They are not able to fill in the information that they need to fill in on the online form.
The participants mostly relied on peer-to-peer information to get access either to the link or to get access to the entire process. Most of our participants who are of older ages suggested that TV channels were mostly the main source of information that they gathered. However, the TV channel just mentions the programs available, but they do not mention the process that they need to go through to get a hold of the link or the application forms. So yeah, door to door, neighbor to neighbor sends the link to another neighbor in case they didn't receive them. So again, there is a certain opacity in why a neighbor would get the link and another person wouldn't. This was their main concern.
So, for example, according to an expert that we actually interviewed, so everything that has to do with online registration, for example, we knew from Ukraine that it would not reach the digitally illiterate. And that's the case in Lebanon too. So we need to make sure that we accommodate these online-driven registration platforms to the digitally illiterate, maybe the poorest, the most vulnerable, the elderly, or the disabled, who will not know how to register on a digital platform. So definitely we should be thinking about using more analog registration or perhaps community-driven or community-based type of registration so that we don't miss this large section of people.
And participants in Abilias also suggested that there were people at the MOSA office who were helping elderly who were illiterate in filling out the applications. But this meant that they had to transport themselves to said MOSA office, which is another barrier that they experience cost-wise.
The lack of feedback and appeals mechanism was something that really was inducing a significant amount of stress for people. So this was a major source of distress. Many described the process as submitting applications into a void. There is no follow-up confirmation. There's no explanation. There's a lack of feedback. And they believe that there's a huge lack of transparency from those who received aid and then whose aid was stopped and then whose aid was continued or discontinued. They really did not understand, like, why would it be discontinued? Why would it stop for a month and then carry on for another month?
This was especially happened around them, so they did not know where to go after the conflicts in the region.
In terms of perceived inequity in aid distribution, there was, yes, a lot of the Lebanese absolutely perceive and believe that the refugees, specifically Syrian refugees, are receiving much better aid than they are. Okay, this is a very widespread perception and belief. The other one is that they believe that that the nationally led programs are less generous, they are less accessible in comparison to the INGO, and this is relating to the question that you just asked me. Next slide, please. In terms of emotional and psychological toll, as I mentioned, a lot of them said that because they received aid, they had feelings of stigma, humiliation, and social isolation. At the same time, those who did receive aid would hoard that information. They wouldn't necessarily tell their neighbors that they are receiving aid because they were so afraid that if their neighbors qualified, maybe they will not get it anymore. Yeah. In terms, again, of anxiety and uncertainty pertaining to unpredictable aid, this is something that we have already covered. Next slide, please. In terms of gender-related perceived challenges in receiving aid, women's economic empowerment versus burden. So a lot of them perceived that it is empowering to receive aid, but it was also a burden for them because they would have to, for example, going to get aid, they have to get their kids and they have to have a stroller, right? And they have to go to the dispensation point, and that actually became a burden. That's one thing. The other thing that was a burden is they had caretaking responsibilities at home, whether it's someone who is sick or their children or a person with disability. So sometimes women really viewed that receiving aid was a burden for them because they have to do all these organizational stuff to go get aid, which depended on a lot of variables that they would have to arrange to be able to go. Widowhood vulnerabilities and administrative barriers.
I just wanted to mention that in Abilias, we met with a woman whose husband works as a painter, and so his work isn't stable, but it's rather seasonal. And she did mention how receiving aid gave her a certain form of financial independence, quote unquote, where she was able to pamper the children with some snacks after they'd receive it. And so she was mentioning that at some point, receiving the money directly, because she was the one who applied and not her husband and whatnot, gave her some form of push within the household. And then the widowhood vulnerabilities were among the cases that we've seen where women tend to apply to the aid in their late husband's name so as to make sure that they would get accepted, which is another misconception in terms of the application processes that they go through.
But if I may add that there was an interesting thing that some widows perceived that they received the aid because of their widowhood. So, but these were, there were mixed perceptions about their social status as women who are responsible for their households with their status as having their husbands dead, what it meant to them. While others, being widows, for example, thought it was somehow adding to the social shame, quote unquote, that they are receiving aid and they don't have anyone to support them.
That's it. They just fear that the death of a husband might create problems with aid continuity overall.
Yeah, so basically her husband died and she just continued. She wouldn't tell anyone that her husband died and she just continued to receive the aid. She was so scared of telling them that my husband died.
The same goes for divorce, cases of divorce, where if the application process was done in the name of the husband in the home and the couple got divorced, it was very difficult for the woman to get access to the aid, especially if she had full custody of the children. So this was another layer of struggle.
Next slide, please. This is the next one. Didn't we talk about this? Okay, it's duplicated. Okay. So in terms of findings, again, there was some interesting findings intersectionally. I mean, when you look at the different areas, when you look at, so there was regional variations in aid access. So it varied widely. In Northern Lebanon, 70% of those we interviewed had received aid. In Mount Lebanon, 17. In Bekaa, 67. In Greater Beirut, 80. And the South, 44. Again, not statistically significant, just showing qualitatively, like, what are the disparities. In terms of social and structural barriers, these included transportation, health gaps, discrimination, and program invisibility across regions. In terms of gender and social identity, women faced care burdens, documentation issues, and shifting gender roles, as we just mentioned, impacting the recipients, their receiving aid. In terms of vulnerable groups, older adults, female-headed households, and isolated families face exclusion from aid due to multiple factors. Next, please. Okay, and the study actually included also, this is something I think Nizar has already seen. So we included mapping recipient journey. And the reason why we did that is we wanted to really take a few cases from those who we interviewed to see where they went in terms of when they received aid, what were the steps that they had to go to, but also what was the emotional toll, i.e. what did they feel at each phase of the receiving aid. So Noor is going to present for?
Yes. Again, so because this was a perception study, it was very important for us to actually ask some tough questions in terms of the feelings and the emotions that were at play when they were going through the entire process. So our first case was a 45-year-old man. He's married, illiterate with health issues. He's a cattle herder. He knew about it through a word of mouth in terms of registration. They really needed that as a family unit. So they did not get a home visit at first, but they suggested that people who had closer ties to the municipalities were more prone to get access faster than the rest. In terms of the eligibility criteria, they found that it was relatively an easy process because it was his wife who took care of the application. The assistants helped the household on a psychological level because they have chronic illnesses, so most of the costs go to cover anything related to medical emergencies or chronic illnesses. The aid in terms of consistency was being received every 28 days, but spent very quickly. They were, however, grateful for whatever amount they were receiving. Again, the aid was spent on medicine and electricity bills, which were the main constraints. And of course, in terms of their current situation, they are satisfied to receive any cash amount whatsoever, especially to cover medication, which was the main common point among most cases, that the aid was covering medical costs in the absence of universal healthcare. Our second case was a woman in Ebelies. She's married to a patient. She's married to a man who has been in a coma for the past 10 years. They applied to Tadamon for 2 years and were rejected. They suggested that it was a computer that rejected their application. She was very convinced that it was probably a miscommunication when she was applying, or she did not know how to apply properly or answers the question properly. When she had a phone call with someone from the MOSA office, and she told them that she didn't really know what to respond. She didn't want to tell them exactly what she owned in the home because she feared that telling them that she had a fridge that she inherited from her parents and another fridge that they got like 10 years ago would not get them selected. And when her husband went into a coma, she put his name on the application because she thought that this was an urgent matter that needed to be covered. He needed medical assistance, and the medical costs to take care of him in the home is extremely expensive. They were accepted for 2 years, and they were receiving it via SMS in terms of notification, and they used to go to MT. It was her daughter who went there because the mother is full-time with her husband, who was right next to us in the next room. And most of the aid goes to milk, medicine, and diapers because she also hosts her daughter in the same home, who has herself a daughter of 2 years. So it's a big household. And she suggested that the $100 lasts a day, you buy the supplies, and then it's gone. It doesn't do anything. They're still receiving aid, but they're very afraid that it might stop. They were scared to conduct the interview with us at first because they felt like giving us information might deselect them, make it stop, which was recurrent in some cases. They were scared at first to talk about it because they were so scared that giving information might stop the aid. Next, please. Okay, this is a case of mother in Sir Doniye who told us that she applied once after receiving the link, but it was because her husband was affiliated to a political party there, and he got the link through a member of the party. They only asked questions, but they didn't have any form of verification. But afterwards, they had problems with the political party and they left it. And afterwards, the assistance was cut off. So the eligibility criteria in this case was that they belonged to a political party, which is how they got a hold of the link in the first place. They were accepted for 2 months. After 2 months, and they received the aid for 2 years without delay. Until her husband decided to withdraw from the political party, and the costs usually went to cover rent, basic needs for the kids. Her suggestion was that she doesn't care about the amount, even if they were to reduce it. She just wants to receive something that would help the family out. They did mention that in terms of the financial crisis, they did think about moving, and that they were heavily relying on someone to get them out of the country. Finally, in Burj Hamoud, we had a mother of 3, 55 years old. She applied 7 years ago, went to the MOSA office in Arcel because she is from there, even though she resides in the capital. So this was a woman we encountered in the focus group discussions who told us that she went to Arcel to get her application done because this is where she had contacts and networks to tell her about the program. The eligibility criteria was that she put the number of the brother's ex-wife, because she didn't have a mobile, so she resorted to other people to apply. She was accepted after a few months, but did not know much about the application process from the social worker when she was there. Everyone is worthy, she said, but they must have some connection. She was receiving the aid via the bank at the time, and it went to rent and medication because she suffers from cancer. So yeah, she has cancer with no health coverage. So this was her main form of income. That's it.
Okay, so our report has 9 recommendations based on the findings that we have just discussed. Next, please. So the larger recommendations is, of course, to strengthen crisis responsive social assistance programs as well as aid continuity, improve communication and information pathways, reduce barriers to access, and enhance feedback mechanisms, mitigate emotional and psychological toll, as well as promote equity in case and aid distribution. Next, please. Integrate gender-sensitive approaches, enhance transparency and targeting mechanisms, link social assistance to livelihood, institutionalize accountability and monitoring, as well as long-term policy reform. Right. So what we did is we broke down these recommendations as to who can do what, and who are the actors and what are the ways that they would actually be able to do this reform. So, for example, in terms of shock responsive measures, MOSA and the DRM, the Disaster Risk Management Unit at the Prime Minister's office, perhaps they would do well in publishing public guidance on crisis-triggered program adjustments. Explain the different aid programs. One of the perceptions that we encountered the most is they don't know who they are receiving from. They are so confused whether they are receiving this from the state or from an international organization, from a charity base. They really didn't have a lot of idea from who was actually giving them this aid. So actors in terms of MOSA as well as the international NGOs should use clear visuals, infographics, as well as communication tools in both English and Arabic. Sorry? Yeah. The communications. Yeah, honestly, I think we can discuss this because I think this is so interesting. Like, how do you reach? Because end of the day, this person who is living, I don't know, in quarantine, right? And they have these multiple pressures. It is almost impossible for them to remember with all that they have to worry about, like who are they receiving aid from?
Especially with people in quarantine after the August 4th explosion, there were so many interventions from different INGOs that were giving them aid for a long while, and they didn't know where to go. And same for the South, they were displaced, and so they don't really know where the aid is coming from, or if it's just simply because they're displaced.
Exactly. UN, الأمم وخلصت. Yeah. Yeah. So in terms, of course, of secure funding, as you know, we are all going through funding droughts with the major lack of funding that is happening, that started in the US and now has spilled over. And here, MOSA, the INGOs, as well as local partners, would do well by establishing multi-year funding frameworks, if possible, and allocate emergency-specific funds prior to a crisis, not when we go into a crisis. Standardized messaging. MOSA here, we expect that multilingual, low literacy, infographic friendly material could be produced. In terms of, we could use of multi-channel communication, not just on TV and what have you, but also dissemination of program via social media, TV, radio, print, as well as in the SDCs. Engage local actors in training. The municipalities as well as SD staff could enhance program understanding for local leaders.
This is especially important for people who don't have logical cues. So many people would resort to go to the municipalities to ask about any programs that are available, and it's the municipality who lets them know whether there's applications are open or not. And I think this is very important for people who are close-knitted in very rural communities and close ties to the municipalities. it's important that they get guidance completely as to the application process. The application status was among the main points that they need to know what's going on with their application process. Why were they stopped? They just need an explanation as to why they were stopped. If they had new kids, would they apply again with an editing into their status so that their new kid could be accounted for and whatnot? So yeah, this is extreme. This was a main perception.
Engaging local actors in outreach. People thought that this would be really important, including the SDCs, municipalities, and local authorities, that they would all do well to coordinate better and ensure the availability of media to all local partners who are functioning at the neighborhood level. In terms of the application process and the feedback mechanisms, as you can see, MOSA, the SDC, social workers, as well as donors could do well in enhancing the application, disseminating content via traditional and non-traditional media, perhaps improving on community registration, engaging SDCs and social workers to assist older persons and illiterate persons. Mobile money, this is something that Corey has also mentioned, so perhaps we're looking at establishing a streamlined and secure payment, including pilot mobile money. We definitely need more Yes, redemption points, that's it, across all neighborhoods so that they have better, it shouldn't only be OMT and the banks. We really should be looking at multiple ways to dispense money. Community consultation, MOSA, municipalities, and the SDD, we should possibly set up town hall meetings at municipalities to engage. And I think, this is really a very interesting point. So I come from a background of urban planning, and as urban planners, we often say that we need to engage the community. And I think having town hall meetings would be really an interesting thing that we could all participate in, because the community needs to have a say not only in social assistance, but in what is being built in its community. What kind of amenities do they need? And I think it's high time that we actually really look into the concept of doing town hall meetings and properly engaging the community, not just asking them.
I think it would allow municipalities also to track and pinpoint what families are already part of the programs, what families are excluded, what new families have arrived that might need help. It's good for tracking who's getting what, where, and how.
In terms of the grievance process, again, the DRM, MOSA, and SDCs could possibly upgrade the 1714 hotline to be toll-free and develop a more secure digital portal. In terms of mitigating the emotional and psychological toll, MOSA and the humanitarian INGOs could perhaps look into mental health training modules targeting municipalities, MOSA and SDC staff, as well as eliminating humiliation and distress by adjusting the delivery protocols to ensure privacy and no harm to beneficiaries. The issue of taking pictures when somebody gets assistance and what have you, it would be best to actually limit that and preserve human dignity when they are receiving social assistance. Having a unified registry, this is something that we have been talking about for months and months and months on end. So managing, updating, and securing beneficiary records to build an accurate, reliable, unified registry with harmonized SOP standards of operations, established data sharing frameworks among the ministries and partners, with regular data updates that would also address perceived inequalities in its design, implement inclusive livelihood projects. Next, please. Yes, absolutely. It's on the new strategy. Yeah, we attended. So in terms of integrating gender-sensitive approaches, of course, we're looking at prioritizing female-headed households, childcare support, and perhaps flexible access in the SDCs, enhance and increase childcare facilities within or near SDCs so people who are receiving assistance have a place to leave their children in. It doesn't have to be a burden. Let us help them also get their aid in addition to livelihood programs. use gender disaggregated data and beneficiary databases, and regularly audit the targeting outcomes to see if women are receiving their aid and it's not a burden to them.
Any changes in the family unit should be documented, because some women did not get aid simply because they were divorced and the husband or the partner used to take care of the money. So it's important.
Revisiting the selection criteria. We all know that the PMT should not be dispensed. However, it would be important to tell people an idea of what is the PMT and what is the general criteria of receiving aid. They don't necessarily need to know the weights, etc., but it would be good for them to have an idea about what the PMT is. Participatory approach to review criteria, multi-stakeholder workshops to review, validate, and update vulnerability metrics and beneficiary selection criteria, and to communicate this updated criteria. The MOSA, UN agencies, INGOs, SDTs, as well as local providers would do well to disseminate these outcomes through policy briefs, workshops, and digital platforms, as well as others. Linking this with vocational training and microgrants, this is also was in the strategy, because MOSA is now linking more to the Ministry of Labor, correct. New economic inclusion units, we should develop a referral system perhaps between MOSA and the Ministry of Labor to provide jobs and build on existing experience, or enhancing microgrants for startup ideas. Transform the SDTs into referral hubs as well. Develop livelihood referral hubs within the SDCs and network with the private sector and NGOs. So for example, in a different study, we have now found out that the makhatir are playing such an important role for people to find houses or to know which buildings are being rented out or are for sale. So perhaps we could do that, that link in the SDCs to actually tell people about livelihood opportunities, job opportunities, what have you. Yes, institutionalized accountability and monitoring, organize community accountability sessions, publish simplified social assistance brief, third-party monitoring, standardized assessment verification, as well as feedback. خلاص? That's it? Okay. So, yeah, a lot of detail is in the report. Thank you for bearing with us. I know it's a super detailed study, and I would really encourage you to read the report. We did our best to simplify it for the purpose of this presentation. And I can open the floor now for...
Yeah, but there's just this piece still.
Oh, sorry. Okay, sorry. فكرت هيدا اللي قبلها لأنه it had the same all right, okay. Yes, so sorry, JP. Okay, so this is recommendation for long-term structural reform. As we all know, we have had a lot of smaller policy interventions, but we really need to work on a long-term structural reform. Progressive taxation-based funding, the government of Lebanon, perhaps the World Bank, WFP, ILO, كلهم فلوا. They should do well in doing some technical assessments on improved revenue collection, progressive taxation, banking sector reform, fiscal analysis, as well as policy simulations to evaluate viability and design options. We should be looking at the designing eligibility and benefit structures that cover all life stages, childhood, working age, and as well as old age. So the poverty targeting needs to have a life cycle approach. We also need rights-based financial system, which means enact legal and policy reforms, including to reduce reliance on external aid, and of course use gender and region disaggregated data to monitor and adjust targeting mechanisms in order to have more equitable distribution of aid. Thank you very much for your patience and for bearing with us. Yes, so any questions that you have, or we can enhance the study or the report, fire away. Thank you.
أول شيء يعطيك العافية. وصراحة there was not... It's very interesting. The recommendations are very rich. I just have 2 points because this comes in the studies in the evaluation and the findings are in line with the previous studies that we've been doing in the last 5 years, at least when I joined like the cash team. So basically, I have 2 points here. Like the recommendations are very rich, but in terms of how can we apply it? For example, let's start with the communication material. I can talk that WFP and UNHCR do a great communication material in terms of materials. However, the scale of the program is huge. When you support 100,000, 200,000 beneficiaries, there is no way you can provide social workers and do case management for all these cases. So I would like to see the recommendations at some point aligned with the large scale programming, because if I'm doing mainstreaming, doing this, doing that, but it's a really huge, large scale. So what is applicable to this kind of programming? What can we do? Also explaining the PMT. We always have a simplified way. There are communication material, for example, explaining the PMT. It's a mathematical formula, this is what we explain. But PMT in itself, machine learning in itself, it's a black box. So how could you explain it if us people who are specialists in our field, even you get a machine learning expert here, how can he explain PMT? It's already in the science, it's a black box. So this cannot be, can I finish, please? Okay. So this is one thing. And also one of the things when we got the recommendation back in 2023 from the evaluation that we did jointly with UNHCR and WFP, it was about the targeting, how transparent, same findings. However, in the humanitarian world and in the development world, there is a tendency for some beneficiaries to overfit the criteria. If you put all the criteria, for example, single female-headed household, you will see all people divorcing, or pregnant women will get assistance. You'll see all the women getting pregnant. So there is a tendency at some point in overfitting the criteria. How you deal with this? Because I see your point and it's totally fair. And I know from my MND, all the ground, that's true. As a beneficiary, I need to know. But also we need to balance between the findings and the reality. And what can we do? People will always, who get not assistance, will not be happy. They will always see it as not fair. This is a must. Thank you.
Actually, okay.
كتار صاروا بس.
أنا quickly ما راح يعني آخذ كتير.
I won't be long. I'm from the WFP. My name is Haya. I just wanted to say that the study is really interesting.
Program. So it's very important to have the study. I won't add more about in general about the study. I started reading the study and thank you so much for the presentation, but didn't finish it yet. So this was very good, the presentation. But again, very good. We have a study for people with disability and their access, but also I would love to see, and maybe Silvana will agree with me, I would like to see people with disabilities inside your study. So when you mention disability, gender disability, segregation for data, by gender, to have it also for disability, the journey, the examples of beneficiaries, to have also beneficiaries with disabilities among the whole study. This would be very great because also we want to mainstream disability inclusion in this study, and it's very good that we have another study. And also another recommendation, when the recommendations are really very interesting, to have also the actors, especially in recommendations related to the social assistance, because WFP, our role, we support Ministry of Social Affairs. We do technical assistance to the social assistance and everything related to social protection, and our role is very important to have this also as actors. Last points. Well, this is very important. In the presentation, it's very nice, the graphics, everything, but please use contrast colors. So we were seeing the font white and the background, maybe it's you will see it's like something silly, but it's very important for everyone, including people with disability and people with visual disabilities, for the visual presentation. It's very nice with bullet points and the design, but make it more accessible with contrast colors. Thank you so much.
Okay, Haya did mention part of what I wanted to, but I want to stress on when you were saying the recommendations, when you talked about community town hall meetings, it would be nice to add that accessibility measures is provided in those meetings so that people can attend. Plus, when you publish any material relevant, we need to take into consideration. And somewhere you mentioned eliminating it would be good to also add eliminating barriers. And and like she mentioned gender and disability, wherever you mention gender, you should mention disability. But one final big recommendation: we can't keep on doing these systems of support without having a vision in the state that parallel covers the different aspects. Otherwise, this will lead nowhere. Will lead us a number of people who are in need will keep increasing. And thank you for this, very useful.
شكرا. اولا يعني بقترح على المنظمه ما له معنى اطلاقا بانه اصحاب العلاقه يعني بريل اذا اقتضى الامر وما شابه.
I suggest you prepare the presentations and studies in Arabic because the stakeholders need to be capable of reading the studies about them. And you might prepare the studies in Braille as well. You know that we're starting from the grassroots and it's not about theory. And I do like the study because it's based on evidence. Anyway, what you did is very good. However, our problem is even more complex in Lebanon. This is what I was trying to say in the previous session. Our problem is overwhelming. It's really larger in scale. Maybe our approach is technically sound, is scientifically sound. However, the approach will not cater for our real needs in Lebanon. I don't know how to express myself. I'm going to give you an example. Take the area of Akkar in northern Lebanon. It's a remote area and it's a forgotten area. You know, it's the poorest region of Lebanon. And it's a very, it has a high demographic density and it has the highest fertility rate. You know, they are Sunni, they're not Shia, even though we think that the Shia have the highest fertility rate. It's not the case. It's about Sunni and it's an agricultural area, of course. So it's a poor area. It has been poor for many years and it's very dense, demographically speaking. And this area had some coping mechanisms. Whenever a young man or an adolescent reaches 15 years of age, he will have his ID falsified and he will start working in the army. So they will all work in the public sector. And you know that the public sector salaries were the salaries that were sustaining the area of Akkar. Without those salaries, they would have been like Zimbabwe. And they used to rely on those salaries, the public sector salaries. And after 2019, everything collapsed. And the real safety net of Akkar does not exist anymore. Do you know what's happening in Akkar now in the current situation? You cannot know. It's actually collapsing. The social fabric is collapsing. Their members of parliament are actually traffickers, and there are some MPs who can walk amongst people with people distributing money. Anyway, you need to know about the situation in Akkad. You're talking about the various criteria and you're talking about the methodology, but does it apply to the approach of poverty? You know, we have policies to combat poverty, and they are applicable to a country where 15% of the population is poor. However, after 2019 in Lebanon, 80 to 85% of the population need assistance. So this paradigm is not applicable, no longer applicable to Lebanon. You know, the poorest of the poor programs are usually tailored to the funding. So we have, let's say, this amount of funding, and we will devise criteria based on 10% of the population, not more. But the situation is completely different today. In your recommendations, you talked about improving targeting in using life cycle approach. But actually, this will exclude 70% of the poor people, and you will be capable of improving the situation of only 20% of the poor. And when the funding from foreign organizations stops, the program will stop. So we have like a systemic program, and we need public policies in Lebanon. We need the governmental policies, and we need the public policies and governmental policies that would give attention to the social aspect. You know, there is the middle class in Lebanon. People who have maybe $100,000 in the bank give those funds to their owners, and they will start businesses. And now, because you're denying people access to their funds in the bank, they need assistance. Maybe they will no longer need assistance if they have access to their money. What you did is correct, actually, and I would like to make a comment pertaining to the communication aspect. Yes, it's true. There is a message that you are sending, but actually this message is not reaching the people it's supposed to reach. We need to recognize this and take into consideration as well what people said, their feedback. You need to take into consideration the feedback of beneficiaries. At the end of the day, the assistance you are paying is better than nothing. $40 for the people with disability are not enough, and maybe $125 for the poorest of the poor. It's not enough. Maybe it's only enough to pay an electricity bill.
I think because at this case, I was talking with my colleague Nizar, and we thought it's very interesting the journey approach to studying the people's experiences at doing that. And I think, at least at the level of organizations like us at Oxfam or others that do provide cash assistance or so forth, I think maintaining throughout our meal programs or monitoring activities, doing a journey approach to seeing how aid is being received, I think it's something very inspirational that can be used from the study. We usually see it in research initiatives, but we don't usually see it a lot within our work on the implementation level. So I think it's something that can also be a recommendation for actors involved in cash assistance as us. So yeah, I just wanted to.
Okay, Bassam, do you want to take the...
I just wanted to mention على سؤالك
كم
وقت
ذكرت
you were asking about how to do this, considering that it's a huge population, it's a huge program. I feel one of the recommendations that we mentioned was local action, local agency. The decentralization is so important بس بتضل within النطاق العام. بس إنه if municipalities والمخاتيrs are more inclined and more trained within the program formation وفاونديشن والانفراستراكشر تبعها منشيل جاب كتير كبير بين انه البنفيشري او النون بنفيشري و the programs themselves. So بيصير في مثل an intermediary بالنص. This was one of the recommendations انه local actors have a big responsibilities بانه يوصلوا البرنامج والapplication process وكل كل الstrategy. So decentralization could be an ideal. صح صح
هون تأسيس دور البلديات أو دور الهيدا ممكن يزبط places بس إنه يكون هيدا الحل on the ground. هلا أكيد بشوفها long term بس إنه هيدا بده تأسيس كتير كبير. It's not something that can be done in the next 2-3 years. It's a long term like 20-30 years planning. هيدا اللي عم نحكيه. It's not
So she was talking about the role of municipalities. She was saying that they need to play an important role in this area. However, this will require long-term planning.
كمان comment اجت.
I'm gonna read a comment. So this is a comment coming from people with us online. They are saying that it's important to note the importance of the life cycle approach, and we need to focus on all categories according to the age category, not only according to gender or sex. So this study actually provides an exhaustive and holistic picture of the situation. And thank you for the study. However, the community in Lebanon has changed. We have more and more host communities in Lebanon, and programs need to be aligned, need to be harmonized. Partnership is still essential and vital, and the partnership and the participatory approach is essential.
All our efforts. So talking about scale is very important. It's important not only in social assistance, but in urban. So we always talk about scale. We go down from, we always do the policy and then regional, and then we go down to neighborhood. And then we go neighborhood, regional, and then we go to policy. And it's very important to connect these three together to actually come to be able to cover the scale. If these three different scales are on the same wavelength, giving the same information, giving and coordinating well between each other, I think the issue of scale could be addressed. Thank you so much for your comments on the presentation and the contrast. We will definitely, JP, look into the presentation and using higher contrast colors so that it's more accessible to other people. Thank you so much for that. Adib, يعني, I don't know what to tell you. يعني, very large recommendation that you provided. But what I can say from the recommendations, but also from what you said, is if you look at the recommendations, they do say that we need to look at the fiscal sector. We need to look at the labor sector. We need to look at the livelihood sector and all of these jointly. I'm not saying that we will get there tomorrow or after tomorrow. Yes, I agree with you. This needs very large policy networks, but also within all of this and within the changes that are happening in the neighborhoods, yes, we need to look at the banks. بدنا نطلع على المصاري تبعولنا وين راحوا. We need to look at several things that are all working together to increase vulnerability in a way that, yes, you're right, perhaps the life cycle approach no longer works, the PMT no longer works. So we need to constantly be looking at things within the crisis and the multiple crises that are happening to be able to reach everyone who is or we consider is the vulnerable poor and properly define what is the bottom poor. Did I cover it all? Yes, yes, yes. We will make sure to relook at the study and include people with disabilities alongside the gender as an important factor. It was, to be honest, it was beyond the scope of this study because there was another study that was being done by Corey on, yeah, 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 deal. Thank you so much for staying. Thank you so much. يعطيكم العافية كلكم.
I see you. Thank you for coming.
Tuesdays and Wednesdays are a busy day. Thank you. Were my slides also? Other issues?
Little bit, but there's like what? Sorry, what to do?
Okay.
Just pay attention. I didn't do it today. Thank you. لا كده انا كده قريبه بس على فكره Thank you. This is a very thank you. Take this. Did Marwan here? Marwan? I don't know, I don't think so.
Thank you. شو ما بترجع تيجي لهون وين بعدين تيجي لهون بلش تعرض الورق روح ركب هونيك على الاخر على الاخر الاخر وينك على يلا انت خلص شغلك هون على شو I could drive them. Trying to how to get his attention, eh? No.